In times of need, people turn to Delaware Hospice. For over 25 years, Delaware Hospice nurses, certified nursing assistants, clergy, doctors, counseling staff, and volunteers have been taking care of patients and family members in their homes. James Police lost his wife of 60 years, but his visits from Delaware Hospice continue. This painting was given to James by his wife Ethel's Delaware Hospice nurse. This moving gift brings back fond memories about meeting the love of his life while James worked at the candy counter so many years ago.
And Ethel had a crush on me, which I didn't know. I was 15. She was only 7. So she would come up and get a penny from her mother and buy a piece of candy, and she'd stand there forever trying to make up her mind. And I used to say to myself, gosh, this kid takes a long time to make up her mind. But she was deliberately staying there so she could look at me. And I didn't know 2 years later that she had a crush on me like that. I look at this picture often because it gives me a lot of nostalgia. It gives me to think back that I didn't realize when she was such a little kid she had a crush on me all those years. And it does take me back a little bit.
Like this painting, the key message of Delaware Hospice is a celebration of life.
We're not about death. Death is actually part of the service, obviously, because that is the end result of the patient's care. But we're actually much more involved in quality of life experiences, trying to make the best of the time that's left, have families share that time together, support one another, and the hospice team essentially surrounds them and helps them get through this time, and then stays with them for an additional year following the patient's death.
Delaware Hospice President and CEO Susan Lloyd has been here for over 20 years. She's overseen many changes over those years at Delaware Hospice. But something that never changes is the quality of care. This is a meeting of Delaware Hospice care experts. They are from different disciplines, medical, social, clergy, but all are on the same team, a team that helps people who are dealing with life-limiting and end-of-life issues. Dr. Andy Himmelstein is the medical director at Delaware Hospice. His message to anyone watching this video right now is that Delaware Hospice is here for you.
The focus is on the comfort. We know that our patients are going to leave us, but we also know that we can do so much to make their last days, weeks, and months as meaningful as possible for them.
Part of the doctor and care team's job is to educate people about Delaware Hospice. Nurses provide support and guidance to families caring for their loved one and oversee a plan of care. Nursing assistants take care of any personal needs of the patients. A social worker listens to the needs of the family member, whether they have financial or family concerns, and they assist with documenting their wishes. The chaplains can offer prayer and spiritual support, and the volunteers can offer companionship to patients or serve as a helping hand to families in need. If you or your doctor are not sure if hospice is needed, just call.
Anyone can make a referral to hospice. Family members, friends, the patients themselves can make a referral to hospice. We're not only here for solely hospice services, but as well as a community resource. Someone that can help get them some support they need no matter what they're going through. Thank you for calling Delaware Hospice. This is Della. How may I help you?
Many people ask, when is hospice care appropriate? Well, a patient can receive hospice care when cure is no longer possible, and the patient chooses symptom management and comfort rather than further treatment. Delaware Hospice services are covered by Medicare, Medicaid, and private insurance. As a not-for-profit, Delaware Hospice is also supported by contributions from the generosity of individuals, families, and community organizations. Once a person calls hospice, the help, care, and compassion comes quickly.
I could actually have someone go out and visit with you probably in the next hour if you're available.
It is a privilege to be asked to walk into their world and be there for support. And it could be for a moment in time to fill a void, or it could be an opportunity to take care of some small details that allows the family to be what it is the family needs to be and do what it is they need to do.
When you don't need hospice but still need help, Delaware Hospice offers its Transitions program. It's a non-medical program of compassionate support, provided free of charge for people with serious illnesses, such as heart and lung disease, stroke, Alzheimer's disease, and cancer.
Hi, guys.
The These children know that Delaware Hospice does so much more than end-of-life care. They and thousands of others are benefiting from the family counseling and support services offered by Delaware Hospice. Kayla and CJ lost their father, but they are finding new hope through the Delaware Hospice New Hope program.
I think the program is a really good program for kids and everything. It brings all of us together. Like, when I first started, I didn't think anybody knew what I was going through until I got there. And then, boom, there was all these kids there that really knew. I didn't think that was going to happen. It did. You're not alone, and that there's a lot of other kids in this world that's going through the same thing. And this camp and hospice helps bring you guys together. And it's not scary once you get into it.
New Hope is a grief and loss program designed specifically for children 17 and younger. The New Hope program helps children explore their grief issues, and we support them through the grief process. We also do a lot of work with parents and help them understand the differences between child and adult grief and how they can support their child while their child's grieving.
Another incredible element to the New Hope program is its summer camp. Look at the faces of these children. These are the faces of Delaware Hospice. When you think about all the good that Delaware Hospice does, remember these images. Kids who've shared their grief, but are finding a place to have fun, to move on, to find new hope. New Hope is just one of many programs that have set Delaware Hospice apart to become a national model for hospice care. The Hospice Center in Milford is the first of its kind in Delaware. The 16-bed facility might be the finest of its kind in the nation, with stunning rooms, comfortable living areas for families. There's even a beautiful kitchen so people can prepare a home-cooked meal if they wish. The Delaware Hospice Center meets the needs of those who require relief for symptoms that can't be managed at home. It's a quiet, private, secure place that nurtures the spirit while easing physical discomfort and supports the family while giving their loved one professional, 24-hour specialized care. Another Delaware Hospice Center will be built in Newcastle County, and none of this could happen if not for the generosity of the people of Delaware. They give of their time and their money. Peg Stabler has done both. She and her husband Laird, a hospice board member, were asked by Delaware Hospice to help raise the millions needed to build the new hospice center in Milford. They did. But then Mr. Stabler was diagnosed with cancer, and the Stablers needed help from the organization they had supported for so long.
The service was absolutely wonderful as far as I'm concerned. I never felt that I was far away from them. At any time I could call, and someone would either call me back or would come here and visit with my husband and me, and I would say the service was absolutely wonderful.
That story is like so many others in Delaware. Delaware Hospice has over 650 volunteers across the state. Retired University Administrator James Mims was lending his talents to Delaware Hospice when his own mother needed hospice care.
Hospice is a great organization, and all the way from the medical director down to the volunteers, they provide you with anything you needed. In my particular situation, all I need to do was call if I had a concern, and within 15 or 20 minutes or so, someone was out.
Again, it comes down to quality of care.
We monitor the quality that we deliver. We compare ourselves with other both nonprofit and for-profit hospices. We take surveys. We have outside people look at the service we're providing, and quality is number one.
Like so many other families in Delaware, these sisters deserve the help of Delaware Hospice. They had taken care of their mother Marie at home for over 5 years, but finally they needed help from hospice. Mary Ann Kane has been on staff at hospice and a volunteer for years, so when she needed help with her mother, she knew right where to go.
It really made a difference in my life. Those that I worked hand in hand with daily then became more than just friends and coworkers. They were the people that led my mother down a path to the other side and really, truly cared for her as though she were their mother as well.
We had to use it again for my mother-in-law, and it was the same thing. They came within 15, 20 minutes. They helped us set everything up. I mean, they're just an organization that is outstanding.
Hospice is for the living. You choose hospice because you want a style of life. It's not about dying as much as it's about how you want to live the rest of your life. And hospice provides the kind of caring, supportive atmosphere that allows people to pass away peacefully and in dignity.
There are many options of care and support Delaware Hospice can give your loved one and your family. Ask us about your choices. Call us today at 800-838-9800 or visit our website at delawarehospice.org.